I am presenting our work in collaboration with the group of CBS that address the association of socioeconomic status with the adherence of oral agents in patients with multiple myeloma. Let's start from understanding what is the relevance in myeloma across the United States. Multiple myeloma is the second most common hematological malignancy across the United States and is the most common cancer across African Americans. Novel oral drugs with or without autologous stem cell transplantation has improved the progression-free survival of patients with multiple myeloma. With the advances of the medications, there has been a shift to a chronic management strategy mode, as well as changes in the drug ways of administration that has shifted the burden of the treatment and adherence to the patient. Poor oral adherence to therapies can lead to drug resistance, poor treatment response, illness progression, extramedical appointments, additional labs testing, and hospitalizations, as well as death and increased healthcare cost. In the US, lack of adherence is the most significant prevalent factors in healthcare costs, accounting for between 100 to 300 billions a year. More importantly, there is lack of data on how low adherence affects multiple myeloma outcomes and the factors contributing to poor adherence in multiple myeloma. So we designed a study with two important populations. One population is a healthcare cohort, which is insured data obtained from insurance companies, that we did a retrospective review of adults with multiple myeloma who have received oral medications between July 1st of 2018 to January 1st of 2022. We excluded patients who have low coverage of less than 6 months after the study index, less than 3 refills for oral adherence, that have received a stem cell transplantation, or that relapse within 6 months of a study initiation. The outcomes that we look at were adherence, medication with a medication possession ratio of more than 0.8, defined as adherent. We also look at PFS, overall survival, and we also look at some Cox proportional hazard ratio to define the causes of changes in the overall survival and progression-free survival. In the pharmacy cohort, we perform a retrospective study of newly diagnosed myeloma who are not candidates for autologous stem cell transplantation, who had a drug coverage through the large pharmacy benefit manager, who received an oral treatment between September 1st of 2016 to September 1st of 2020. Patients were excluded if they were not eligible for a pharmacy benefit manager program for the 6 months prior to or 12 months after the index date, and if they had a stem cell transplantation based on a proxy signal. Adherence was defined as an annual medication possession ratio between 0.8 and 1.2. A socioeconomic index composite index was developed using zip code levels factors in a k-means clustering algorithm and validated against the CDC Social Vulnerability Index. We performed multivariate logistic regression for adherence using the socioeconomic index and control to other patient-specific demographics. So let's start with the results. First of all, let's show the distribution of all the patient population and how we end up with a very pure population. In the first, the healthcare cohorts group, we screened 21,000 patients, of which we end up excluding about 16,000 patients that left us with 830 patients. Because we excluded patients with commercial insurance plans, we end up with only 600 patients. On the pharmacy cohort, we started with a total of 37,000 patients, of which we end up only with 13,000 after excluding for all the criteria that we have discussed above. And also, after that, we excluded those patients that had an index of possession of less than 180 days prior to the index of possession, or that were not enrolled for 350 days post-index of inclusion. That left us with about 7,000 patients. So in terms of the result, the first thing that we wanted to do is to validate whether or not our socioeconomic score index was accurate and correlated with the CDC Social Vulnerability Index to prove that it's reliable index. And as you can see here, our data demonstrated that when we divided into very low, low, medium, high, and very high categories, our correlation between the two index was very high, suggesting that our data analysis in the coming data that I'm going to present is accurate. So the most important factors were overall survival and progression-free survival. Our data here show for the first time in multiple myeloma in a large-scale study that oral adherence to the oral medications for multiple myeloma changed or affected the outcome of this patient population. In this slide, we're going to show now the impact that adherence to oral medications in multiple myeloma had on the outcome of these patients. On the left side, you will have progression-free survival, and on the right side, we will have overall survival. In this data, we are showing for the first time in a large-scale retrospective study that adherence to therapy affected the progression-free survival and overall survival. As you can see on the left side, adherence to treatment improved by 13% the progression-free survival of the patients with multiple myeloma. Importantly, and more importantly, is that the overall survival was improved by adherence to this medication by 18%, both of which have very significant p-values. It's important to highlight that no medication in multiple myeloma, except for one manuscript published, has shown improvement in overall survival in multiple myeloma. And this is probably due because the adherence to treatment has been very homogeneous during the studies, but in the real world, this adherence to treatment has shown higher improvement in overall survival than any other medication in multiple myeloma. What factors, when we went deep on the analysis of what factors could be affecting adherence to treatment to oral medications in the two cohorts, we identified first that in the healthcare cohort, comorbidities as well as the geographical location were factors that affected adherence to treatment. Patients who have more comorbidities or patients that were located, and I'm going to show this later, in the mountain region as well as in the northeast and north central east were regions that had low adherence to therapy. In the pharmacy cohort on the right side, because of a larger number of patients, we were able to demonstrate in more detail what factors were affecting adherence. And as you can see here, age was one of the factors, socioeconomic status, geographical location, and insurability. In addition, we look at other factors such as polypharmacy. And in this slide, we are showing that the higher the number was of the number of medications that the patient is taking that are not just medications for multiple myeloma will impact the adherence to these drugs. And in summary, if you have more than 5 medications outside of the medications of multiple myeloma, you will be associated with a higher poor adherence to medications in multiple myeloma. When we go in detail with the adherence to all the medications for multiple myeloma, we identified that pomalidomide, cyclophosphamide, melphalan, and thalidomide were medications that had a higher rate of non-adherence than other medications. In addition, we also identified that the amount of mean copay was an important factor to determine the adherence to these medications. Here I'm showing an odds ratio analysis demonstrating all the different factors in a graphical way that affected the adherence to medications in multiple myeloma. But in summary, what we can identify is that younger age, lower socioeconomic status, polypharmacy, specific geographical regions in the US, such as the East, North Central, Mountains, and Mid-Atlantics, are associated with poor adherence to treatment. In conclusion, this is the first large-scale retrospective study demonstrated that low adherence to oral medications is associated with lower progression-free and overall survival. No previous studies No previous prospective studies of oral medications have shown difference in overall survivals. Hence, this study highlights that the real-world data that outcomes in multiple myeloma can be improved by increasing adherence to medications in multiple myeloma. Factors that affected adherence included patients who are at young age, lower socioeconomic status, specific regions in the United States, polypharmacy, and co-pays. Factors that were associated with poor progression-free survival and overall survival included medication adherence, worsening comorbidity, and increased age. Thank you.